Thank you very much for the introduction, and thank you for giving me the opportunity to present to you today a research project which was conducted at the Clinic for Ruminants in Munich, where I am currently located. So this is a study about pain. So one of the first things we need to ask ourselves is, what is pain? And pain, by definition, is an unpleasant sensory and emotional experience with an actual or a potential tissue damage. The problem with pain is, in humans as well as in animals, that it is always experienced subjectively, and cattle are very stoic animals that strongly master pain, so the pain evaluation in cattle is more difficult than in other animals. 2 days ago, there has been the keynote lecture about behavior and behavioral criteria, so I don't need to go into this too much. There is also a possibility of evaluating pain using feeding and rumination time, for example, using specific halters like the one pictured on the right, which decrease when an animal is in pain or in stress. Also, there are biomarkers for pain. Cortisol is one of the best known, and it is well reviewed. Concentrations can be measured in blood and in hair. But the problem with cortisol is that it increases dependent on the stressor and on individual anxiety-related behavior. In the last 10 years, substance P has come more into focus in pain research in ruminants. P is the abbreviation for pain. It is a neurotransmitter which is secreted by neurons and by immune cells, and it can be found in the areas of the neuraxis, and the neuraxis is known to be involved in the integration of pain, stress, and anxiety. It is known from animals as well as from humans that pathological pain leads to a release of substance P, but also that inflammation and cell-to-cell communication increases substance P concentrations, but this has only or mainly been shown in humans so far. Research about substance P has mainly been done in stress and in painful situations in cattle until this point. And in 2008, a study showed that substance P was significantly higher in castrated compared to sham-castrated calves without local anesthesia, contrary to cortisol, which was increased in both groups. So already 10 years ago, the question popped up if substance P could be used to differentiate between stress and painful events, and if it could be a more objective biomarker for pain than cortisol is. So the objective of our study was first to evaluate the plasma substance P concentrations during umbilical surgery in cows, as this has not been done before. And we wanted to answer the question if the administration of metamizole additionally to meloxicam results in lower plasma substance P concentrations during this umbilical surgery. For our study, we did have 21 cows with an umbilical hernia, but otherwise sound general condition. They were either brought to the clinics as patients or they were bought at markets in Bavaria. They were aged around 38 days and weighing 80 kilograms. The study was conducted as a randomized controlled double-blinded trial. We did have two groups, the control group and the treatment group. And on the day before the actual trial, a catheter was placed in the jugular vein after sedation with xylazine so that this pain and stressful event would not interfere with our results on the day of the trial. So here you can see the treatment of both groups. As you can see, the treatment was the same for the control group and the metamizole-treated group concerning sedation and initiation of the anesthesia. General anesthesia was maintained using isoflurane, depending on the effect of the calf. All the animals received an antibiotic on the day of the surgery and for the following days, and all the animals received a non-steroidal anti-inflammatory drug on the day of the surgery. The control group then received sodium chloride as a placebo, and the metamizole-treated group, additionally to the meloxicam, received metamizole as a pain medication. So this is the outline of the study. We do have the preoperative phase, the intraoperative phase, and the postoperative phase. All the animals received meloxicam 2.5 hours before the start of the surgery. Surgery started at 10 a.m. with the skin incision. The first blood sample was taken 60 minutes before the start of the surgery, which was then referred to as the baseline concentration. And after this, the animals received either the sodium chloride or the metamizole. Anesthesia was then initiated using xylazine and ketamine, and further blood samples were taken 5, 15, 30, 45, and 60 minutes after the start of the surgery, and 3 blood samples were taken in the post-operative time. So the study was conducted by one of 2 assigned surgeons so that we wouldn't have any interference by the surgeon. And we did have this pretty strict protocol. We always took the blood samples 1 minute after the painful procedure. So as you can see, 5 minutes after the start of the surgery, subcutaneous tissue was preparated. Then the navel vein was ligated. 30 minutes after the start of the surgery, suturing of peritoneum, fascia, muscles, and subcutaneous tissue was performed. And 45 minutes after the start of the surgery, the skin was sutured. Before blood sampling, the intravenous catheter was always flushed with sodium chloride. After blood sampling, the blood was transferred to 2 ml EDTA tubes. They were spiked with apritonin. Apritonin is a polypeptide, which keeps the substance P from destabilizing. And also you need to bring the blood samples with the substance P to the laboratory pretty soon or pretty fast after the surgery, because otherwise it will interfere with the results. We did perform the analysis using a substance P ELISA kit after the end of the trials. This kit has been described in previous literature, as well in human as in veterinary medicine. For the results, unfortunately, the data were not normally distributed, so the values are given as median. And one thing that we saw when we did have a look at the data was that in some animals, there were really high inter-individual differences. And these I will show you in 3 animals of the control group. Animal number 10, for example, started with around 300 picograms per ml of substance P, increasing slightly during the course of the surgery. And the last sample we took were around 350 picograms per ml. Animal number 21, already 400 picograms per ml higher than the first animal, with around 700 picograms of substance P, and at the end of the surgery, around 850 picograms of substance P. And then animal number 27, which completely was out of the line, already having 4 times higher concentrations of plasma substance P concentrations even before the surgery started. And also in the end, the last sample we took were around 2,000 picograms per ml of substance P. For the overall course of plasma substance P concentrations, the control group is given as the dark line. The baseline concentration was 690 picograms per ml, increasing during the surgery with a significant difference to the baseline concentration 5, 30, and 90 minutes after the start of the surgery. And as you can see, the animals in the control group never reached their baseline concentrations during our blood sampling. The animals in the metamizole treated group already started out with lower concentrations, around 590 picograms per ml, decreasing slightly during the course of the surgery, and they already reached their baseline concentrations 30 to 150 minutes after the start of the surgery and remained in those baseline concentrations. Also for the area under the curve, which was around 200 picograms per ml lower for the metamizole treated group compared to the control group, there was no significant difference here, but again you can see that the values are lower than in the control group. So for our discussion, the results are a bit hard to compare with previous studies. We did take an umbilical surgery for our study because it was possible to standardize the procedure. But the problem with an umbilical surgery is that it takes longer than, for example, a castration or dehorning, which have been done before. So our painful stimulus went on for nearly 40 to 45 minutes compared to 5 or 10 minutes of, for example, castration or dehorning. And also, this is one of the big limitations of the study. We did perform the surgery in both groups. So we did not have a sham surgery group where we can see if the substance values would also increase if the animals are put under general anesthesia, but no surgery would be performed. We did have significant differences in the control group, 5, 30, and 90 minutes after the start of the surgery. At these times, painful procedures were performed. 5 minutes after the start of the surgery, the subcutaneous tissue was prepared, and 30 minutes after that, the peritoneum fascial muscles were sutured. This is known to be more painful than, for example, exploration of healthy intestines. Also, ketamine might have had an effect on this. The half-time of ketamine is around 30 minutes, and it was given 30 minutes prior to the skin incision. So it could be that the analgesic effect of the ketamine wore off around the time when we started the painful procedures. Like I said, there were large inter-individual variations between some of the animals. These have been described previously, and there seems to be a wide variety of psychological and physical stressors that release substance P. And also, and this is also one limitation, one big limitation of this study, stimulation of the immune system due to inflammation results in increase of substance P, as has been described in humans, but this has not been shown in cattle so far. So the big problem is that there is a lack of physiological ranges of plasma substance P concentrations, so we don't really know what's normal and at what point or threshold nociception begins. So there is need of further studies. Preemptive analgesia is always recommended to prevent the onset of nociception, which is known as multimodal pain management. In our case, we did use an alpha-2 agonist, xylazine, which has been described to inhibit the release of norepinephrine and of substance P, and also meloxicam, which in a previous study resulted in a 50% reduction of plasma substance P concentrations during dehorning and after dehorning. But we did use these drugs in both groups, so I think that in our case we can neglect the factors that they have on the substance P levels. So, to come to my conclusion for the evaluation of plasma substance P concentrations during umbilical surgery in calves, we did show that they increased during a painful procedure, possibly due to the nociception. And to answer the question if the administration of metamizole additionally to meloxicam results in lower plasma substance P concentration during umbilical surgery, we can answer this with yes, which might indicate that substance P could be used as a biomarker for pain in calves, but like I said, the study has limitations and further studies are needed to strengthen this hypothesis. With this, I thank you for your attention, especially in front of lunch, and I'm happy to answer your questions.